Okay.
All right, well, good morning, everyone. And first off, I want to just kind of introduce us. We are the Senior Care Alliance group. We're just a group it's a nonprofit where we come out and we give free education and free handouts on things in the community that can help you guys be successful by being healthy and active in the community. So we got several representatives here that are a part of our group. These people use their spare time by coming out here to talk to you guys, and so we are really compassionate about what we do. Today we brought a speaker with us, Ms. Jennifer Davenport. I'm going to introduce her. Once again, we're Senior Care Alliance, and we're just going to kind of love on you guys a little bit. We brought some sweet treats. We stopped at Paul's Bakery, so there's many options over there. If you guys have questions, this is a very comfortable environment, so just feel free to raise your hand if you have a question. All right. This is Miss Jennifer Davenport. She works for Apello Health and Wellness, and let me just add, she's an excellent wound care nurse practitioner. So we're so happy to have her, so let's go ahead and bring her to the floor.
Good morning. How are you all? Who's excited about wounds while you eat? Things that you normally don't want to hear about, but that happen to a lot of people that don't even realize that they have anything going on or at risk. So they're sending out a little flyer with paperwork to kind of just go over what I'm going over with you. So I've been a nurse practitioner for, 15 years. I've been doing wound care for 21 years. I've worked at Sparks Hospital, if y'all know Sparks. I never worked at Baptist, but it was Sparks. And then I've been at Mercy Wound Clinic for 13 years, seeing patients with bed sores, skin tears, everything like that. So they asked me to speak to you today because I'm now in a new company. We're called Apello. It tells you a little bit about our wound program on the first sheet. So we go to nursing homes. So that's where a lot of patients have wounds. So I go to Ashton Place, Ozark, Broken Hill, Elma's where I was at this morning, Chapel Ridge, Greenhurst, Oak Manor, Valley Springs. So our program is to provide the best care for preventing and treating wounds to those patients in those nursing homes. So if you have yourself or loved one gets admitted to those facilities and you have a wound, you'll see me. I have 3. I'm the director of our wound care program, and the wound care program tells you a little bit about what we do in those facilities. So,
Before you go any further,
yeah.
we're going to go ahead and we're going to do our budget.
Oh, perfect.
And so we can give them our vote, and then you can go ahead and speak. Okay?
Perfect. So let's stand up and do our pledge of allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord, we thank you for this day. We thank you for your many blessings. We thank you for each and every one who gathered here today. We just ask you, Lord, bless this food, nourish our bodies, and bless thy kingdom. We ask these things in Jesus' name. Amen.
Amen. Thank you.
Okay, let's leave this here.
Okay. Okay for me to continue? Okay, perfect. So again, that just tells you about our program, which nursing homes, facilities we are in the area. Yes, no, you're fine. So how many of you have had a bed sore, pressure ulcer, know someone who's had one, or just do not want to get one? Everyone. So, exactly. So the second page, it's more in terms that y'all will know, but it's what the nurses use in any facility, hospital, home health, to tell us if you are at risk of getting a bed sore, pressure ulcer. So these are something you know if you are at risk risk of getting one. And this can change on a daily basis. So what you're doing right now, you may be at a low risk, but say you get pneumonia or you get a stomach bug, something happens, you're sick, you're down, your risk where you normally would not be at risk of getting a bed sore, those days your risk might be higher, and that's what, it's usually a perfect storm when patients get a, I'm using bed sore just because that's what most people hear it as, pressure sore. Yes?
What actually causes a bed sore?
So there's a lot of things, and we're gonna go over this, okay? It's your risk factors. So our skin is our number one organ, the biggest organ in our body, not our heart, not our brain, but it's the first organ that shows a problem if you have something else going on. So our risk factor is, can you feel your skin? So who would that be? If you're paralyzed, how many of you have diabetes? You know, you can't feel your feet, you have numbness. So while you're sitting here, how many of you guys, these are very nice chairs, but how many does it hurt your bottom and you have to readjust because it doesn't feel good? So you have the
restaurants.
Exactly, restaurants, any different places that have chairs, they're not the most comfy. Another place that I see is recliners. A lot of people like to sit and sleep in their recliners, and people will get what we call recliner butt, and you don't realize it. But again, risk factor is that you can't feel this, and then again on this, there's like number one, can't feel, all the way to feel normally. So if you circle what number that correlates to what you are, and at the end you can tally all this up, this will tell you your risk. Second is skin wetness. So how many have incontinence of either you dribble a little bit or you can't make it at all and you have to wear pads. So a little bit of wetness to being all the way dry. Again, activity level, you guys are walking daily. Y'all are really good about preventing the bed sores. But if you can't walk very well, or you know someone who is down and are at home and you walk just to the bathroom, back to your chair, go to the kitchen, get you something to eat, back to your chair, that's decreased mobility, so you're at risk of getting a bed sore. Moving yourself around, all of you guys, you can lift yourself and move, you're less likely to get a bed sore. But if you can't, you get weaker, you get pneumonia, you get something, and you can't lift yourself up, that's where you get more of a risk factor. Another one is the friction and sliding. So this goes back to being the weak. So if you're sitting in the recliner or you're trying to get up from any chair, but you're weak and you scoot and you're not able to push yourself up independently and you scoot, I like to tell people your butt will begin to look like cheese, going across a cheese grater. So that's friction. If you can't get yourself up,
They got a plate.
thank you. Yeah, so that's why it's important not to scoot. We tell people don't scoot, get up. So that's very helpful. And then eating well and nutrition. That's why you're here, to get nutrition. So that really helps you prevent pressure ulcers. So a lot of times in the facilities, whether it be the hospital, a nursing home, rehab, any place like that, a lot of our patients actually come in with their bed sores, pressure ulcers, at least starting. So, and most people don't realize that they are at risk or even have one. So that's another good reason for y'all to be aware of this information. Again, the second one, again, it just talks about it can happen to any of us. Again, if you're sitting too long, lying too long, so what can you do? Again, move around. If you can sit here and your bottom hurts, you know to readjust. If it continues to hurt or whatever, again, people lose weight, you don't have the fat cushion like you used to. That happens where we lose our fat tissue where we don't want it to be lost. One of those is right over that tailbone. And so that tailbone hurts when you sit too long. A lot of people will go out and will get a donut cushion. This is one place we don't want donuts either. Actually, science has told us donut cushions cause pressure ulcers. You would not believe how many people I've seen in the clinics that come in and they're like, well, we were trying to help mom, dad, ourselves. We got a donut cushion and it puts pressure where you're sitting on it. It takes the pressure off your tailbone, but those other areas you get a bed sore. So donuts are not good, but they were on the right track of getting a cushion to sit on. So there's different cushions out there. We used to, a lot of the facilities, we use a waffle cushion. So I would tell patients, no donuts, but choose waffles. That's just a brand name. You can find them Amazon, Walmart.com, different things for like 20 bucks. They're portable. You can move them to wherever you go, light. So I love sewing and crafting and stuff like that. My aunt was a quilter, and so beautiful, but you get in here, you sit for hours and you don't move, and that can be a risk factor for a bed sore or pressure ulcer. So again, if you notice that your bottom is getting to be a little bit sore, you might just think, oh, I need to get up and walk around. So that's a good thing that you can feel that your bottom is getting sore. So if that's the case, get up, walk around, get some blood flowing to your skin. Most people think it's bottoms, but it can also occur to, again, kind of the feet and everything, because if you're diabetic and you can't feel, and you wear a shoe that's too tight, or it's rubbing, so then you can get blisters and wounds, and then if you're diabetic and you don't have good blood flow, then it starts to blister, where in our teens and 20s, we would take that blister, put a Band-Aid on it, and we'd be fine like the next day. But those can evolve, and that's where people will begin to have wounds, get infections in the skin, in their bone, and start losing toes and feet, and we don't want that. So very important, again, to check your skin all the time, not only your bottoms, but your feet and everything. Again, when we talk about the risk factors, the moisture, not only incontinence, but also your feet. If you're sweating, different things like that, you can get moisture, yeast, fungus, anything like that, and that can break your skin and puts you at risk of getting further wounds. So we talked about if you are sore and you feel it, get up and move. Again, that can be from sitting, it can be in a recliner, laying in bed, can be anything. Moisture on your skin, again, urinary incontinence, which I'll go over that here in a little bit, but also moisture from sweating, wet feet, anything like that too. Again, the rubbing and sliding, again, watch your bottom so that you're getting up and moving and not sliding, and eating nutrition and staying hydrated. So that's very good, very important. Any questions kind of on that part, bed sores? Okay, so.
Well, in reality, what it is a breakdown of the skin, right?
Exactly. It starts, and most people think pressure or bed sore, but it can be from anything that causes a break in your skin. Pressure, friction, moisture, things like that, all are the risk factors.
It contributes to the
Yeah.
problem.
Exactly. And it's still kind of the same thing, but I'm going to transition into the next kind of wound that most people will see. skin tears. How many of you guys, your skin gets thin and it tears easily and you get lots of bruising and then you get a wound on your arms? Very common. So what happens, our top layer of skin and our bottom layer, they have these little ridges and they stick together. So when we are young, and it sticks together, but as we age, or mature as I call it, you get mature skin, those ridges start to flatten out. So I tell people your top of your skin, your bottom of your skin, it's like a Ziploc bag. You know, my grandma, my mom, we all saved our Ziploc bags, you know, growing up. We had to wash them and dry them, but if you use them over and over, you stick them, you pull them apart, they don't stick as well as we use them over and over. Same thing with your skin. As we mature, the skin doesn't stick together, so that top and that bottom layer separate a little bit more. So any little bit of trauma, you get that bleeding under your skin. All the little bruising that people will have, they think, okay, that's because I'm on blood thinners, this and that. That makes a risk factor, but it can also be, it's just that bleeding under the skin as we age. And there is a name for it. It's called senile purpura, which just means bleeding under the skin as you age. Senile. But again, your risk factors for the skin tears, again, the thin, fragile skin, that occurs when we are dehydrated. So very important to make sure you're drinking your water and staying hydrated. Dry, cracked skin, the bruising or the weak blood vessels, that's under the skin. Again, being older, more mature. If you've had skin tears in the past, that's a risk factor. Again, nutrition. If you're not eating good, if you're losing weight, you don't have good protein, or you're dehydrated, that's a risk factor. Again, the medicines we talked about, sometimes steroids. How many has a lung problem, arthritis, an autoimmune disorder, you get put on prednisone or a steroid, that makes you more prone to skin tears too. Again, trouble walking or balancing, we bump into stuff. I bump into my doorways all the time, but you know, a little bit of bump, you know, over time, that can cause someone with fragile skin to get a skin tear. Again, the sliding, dragging in your bed, in your chairs, our long nails, jewelry, you know, anything like that too, that can just accidentally bump you if you have all your jewelry on and accidentally hit yourself or scratch yourself, that can occur. Cluttered rooms, or even being rushed. So say you're just hurrying to get your dog out the door. You know, I had that this morning, running to get those dogs out. You bump yourself, you get trip, anything like that, and then you can get an injury and a skin tear. How do you prevent that? Again, making sure you're drinking your fluids, staying hydrated, getting nutrition. If you're really prone to skin tears, protecting that skin, so long sleeve clothing is helpful. Sleeve guards, my husband, from the time I've met him in his 20s, when he went to move, he had these skin guards on, or these sleeves on his arms to move stuff to protect his arms, and I always laughed at him. Well, now I know. You know, those are things that you can do to protect yourself. They're out there. All sorts of places have things like that to wear, just skin, to arm guards, just for protection. Sometimes I tell people just an old tube sock, cut your toes out and put it on, especially that'll just protect you. And you usually have an old pair of socks that you may not wear anymore that have a hole in them. Just cut that tip off and it can help you protect your skin. Again, protein is very important for wounds to heal. So, if you're not eating much or you have a decreased appetite, a little protein shake, sometimes that's helpful. Peanut butter, eggs, fish, meat, tuna, those are good things to help keep your nutrition and your protein up. Any questions on skin tears? And then the last thing that we see a lot in the facilities is incontinence-associated dermatitis. So again, if you have incontinence, as we all do, you've had kids, had surgeries, you know, all those risk factors, men, prostate issues, if you've had prostate surgeries, different things like that. Stress of when you move, you leak urine, cough, sneeze, that can happen. So if you wear a pad or, you know, a brief or something, very important to change it often, because if it's wet, think of your babies that you had, you know, diaper rash. We get it if you have to wear one of those incontinent briefs and stuff. So it's not only our babies that we have to watch out for. It's something to think, what did you do for your kids when they were wearing their diapers and stuff? You are not wearing a diaper, you're just wearing a protective brief. They do make panties and stuff out there now that are for periods and incontinence, so that you can just take them off and throw them in your washer too. Those are nice too. They keep you drier if you just have a little bit of incontinence. But very important to change those wet pads frequently, because if it's against your skin, it causes irritation, doesn't feel good. Again, if you have even a GI bug that comes through, make sure you're cleaning yourself well, because that little bit, if there's anything that's left there, that can start eating through your skin and causing irritation. So again, having some good wipes there, some that are skin friendly, not, you know, fragrance free, all that stuff. Keep your skin clean in between things. And then what did we do with our kids? Is we put, well, back then, you know, a lot of Desitin. Well, they have all sorts of different things out there now. Vaseline is a good old standby because it protects your skin from moisture. And then there's all sorts of different diaper rash ointments and things that you can get that just protects your skin. Because again, once you start having that skin breakdown from even incontinence, that's the risk factor that's going to cause bed sores and stuff. So just watching that. Excuse me. Any questions so far? Most people don't realize incontinence causes any problems too, but I did urology for 3 years, so, and I'm also, my certification is wounds and ostomy and continence, so I've dealt with a lot of incontinence issues too, so it does cause a lot of skin issues. Oh, I know what I was going to tell you. If anyone ever went to the wound clinic, we always had what we call the magic butt paste. And it is just a mixture of over-the-counter things. So, zinc, it's a tube of zinc, a tube of, say like Lotrozone, antifungal, like athlete's foot ointment that you can get. And I say generics, perfectly fine. And then like hydrocortisone cream, 1%. You can just mix those together, and that is a good protective skin ointment too. So it's really good if you have yeast, because you can get skin irritation, yeasty areas where there's moisture, dark moist areas, that's where yeast grows. Under the breast, under the belly, and then in the areas of the nether regions too, you can get it. One other thing, just a tip, who uses loofah sponges to wash with? My daughters love them. They love the body wash. Again, when I was before a nurse, my grandmother was lived in a retirement facility and had her wheelchair, and she'd go into there. Loofah is just wonderful, but she had a case of yeast. Yeast is spores, and it lived in her loofah, and she got it from head to toe. That is a visual I never can forget. So loofah sponges, watch out, because they can spread yeast to all your other regions. So watch that. Are we getting on time? You're good? Okay. Any questions? I just tried to tell you some tips and tricks I've learned across the years, because a lot of times these things are not what we want to talk about or ask about in public, so I try to give you as many tips and tricks and stuff that I can do. But big thing, nutrition, protect your skin, move around. If you have a sore bottom and you feel it, get up and move around. Stay as strong as you can, getting up and moving, staying busy and strong, that's very helpful. So these are tips for you guys, but also friends, families, anything like that, but just watch it, because we do not like bed sores, we do not like skin tears, and we don't like having diaper rashes. So, but hopefully you will not ever have to see me in a, I used to tell people I was the official butt checker, so you don't want me to be officially checking your butt, but I'm there for people who do need it. So, any questions? Oh, we got it.
Not how much did you got your hair,
So, when I was actually, the insurance covers that. So if you have a wound, and if you're out in the community, that's where you go to your physician. For the show, they can refer you. Maybe they know, can look at you and know exactly what to do without making it worse.
You know that we now have a dog here in the pharmacy in Yorkburg?
I
So
saw
exciting.
that. So,
And it's a River Valley PCP clinic. We got a rep
Yes.
for River Valley here. So yes.
so guess who I trained with as a nurse practitioner? Wendy Gaston and Dr. Seals.
Yeah.
Wendy, I know, has been here forever. I love Wendy. She's wonderful. You'll have Dr. Burks here now. So, she's Jennifer Elaine Burks. I'm Jennifer Elaine Burks. Oh, very rare. But yes, I love Dr. Burks. So that's wonderful. Yes. And then so, in home health. So again, if you have home health services, they are trained, they need to be looking at skin and taking care if you have one. Where I'm at in the facilities, yes, I do think we will, it's a new program, but our owners are a group of nursing home owners that do not like what they were seeing with their skin and wound patients in their facilities. Because of being in the clinic, I would see people too late a lot of times. And so that's what they're like, they wanted to have a good program starting in their facilities. So I'm here locally, and again, trying to get people taken care of before something gets bad. Or, if people go in for rehab and they're like, oh, we're not gonna focus on that. We're gonna focus on all this. You can deal with that when you get home. Well, again,
How do you get paid?
so I get paid for my company. So,
So you
I'm
know
an-
if it's an insurance thing.
they will submit it to insurance. So if you're in a facility, like where I'm at, it's all
It's all included in that.
kind of included, and you will
get you some more information, okay?
You want to give your phone number, Jennifer?
Oh, I've got business cards. It has my email, but I don't have my phone because all I have is a cell phone. We don't have a clinic or a specific number. But you can always email me with questions. I'll leave these at the table here.
Well, if we can give her a round of applause. Jennifer, thank you so much. So, once again, Jennifer came out and to give us her time and just to come out and help people. Like, that's all of our missions here. If I can have all the members raise their hand of Senior Care Alliance, all these people that are raising their hands that are members of Senior Care Alliance, they are here to help you. So you have people right here in front of you that's going to be advocates for you, which means that they're going to give you right information, and you have someone right in front of you. If they can't help you, maybe somebody else can in this room, but we're here to help you. So the information that's in your bags and our phone numbers and stuff, I know you don't need us right now, but there can be a time where you're like, oh my gosh, somebody talked about this, but I don't remember who. But if you can remember Senior Care Alliance, we do have an email, or even if you have somebody's cell phone number that's in your bag, call us and tell us who you heard and what kind of care you're needing. Maybe it's the wound care. Maybe you're needing somebody to talk about primary care, or if you're falling and weak and just really don't know what to do. Remember, there's information in your bags. And just thank you for giving us your time. The one last thing that we're going to do, we're going to take turns, all of us kind of real quickly coming up here telling you what we do for a living, so that way if you do need that assistance, you can talk to us directly. And then also we have door prizes, so don't run off just yet, okay? I want to make sure everybody has signed in. Has everybody signed in? It's your normal sign-in sheet. So if you signed in on the blue papers when y'all came in, the normal sign-in for here will have your name. But Cassie has it in her hand, so if you need to sign in, if you'll raise your hand, because that's how we do our door prizes. But I'm just going to introduce myself. I am Ashley. I'm the Vice President over Senior Care Alliance. But my day job, I work for Mercy Rehab Hospital. We're just another option for rehab. With it being a hospital, you do have to stay in-house with us for a minimum of 5 days. For what kind of triggers you to come to rehab is you're falling and weak. Maybe you went from being able to walk by yourself to now noticing that you have a little bit of a need for your walker more than usual. You're falling. Maybe you're not getting around at all, or no friends that aren't. You don't have to have a doctor's order to come to inpatient rehab. All you have to do is pick up the phone and call a rehab hospital and tell them you need the care. Cindy and I are here both. We have the same level of care for inpatient rehab. Just reach out to us and call us. Once again, I work for Mercy Rehab Hospital. We'll do the 3 hours of therapy a day, get you stronger and home. Our mission and goal is to keep you home, keep you here as independent as possible. And I will pass the baton to whoever's next.
Hello, my name is Adriana Lacey, and like they mentioned it before, I'm representing River Valley Primary Care Services, member family clinic. And yes, I was here to do the grand opening for the pharmacy in the new building. It's a beautiful building, it's bigger. And our providers, they work with all these people to refer you whatever you need it is, for that they are aware about these great companies helping our senior population. And any question you have, we have a great staff and great providers in these clinics, and also the pharmacies. And if you have any questions, you can just call them. And our office manager there, her name is Angel Ray. Probably you familiar with her already because she's from this community, and a lot of people that are really familiar with her outside the company. For that, I will let somebody else talk. Thank you.
I'm Brittany with Heart of Hospice. We do palliative and hospice care in our area. Just to kind of tie into the wounds, that's actually a really big trigger for us when we're looking at eligibility. Like she said, nutrition is a huge part of wound healing. If we get to the point where the wounds are not healing and we're doing optimal treatments and they're just either staying there or getting worse, those are triggers that you may be eligible to receive extra care with hospice. So if you guys ever have any questions about that, you can reach me at 479-462-7932.
Hi, I'm Cassie Barnes. I'm from the Blossoms in Van Buren. We have Crystal from the Blossoms in Portsmouth over there. We are a long-term care and skilled facility. We have male and female memory care units. I have VA contracts, so if you're a veteran, we're the only one in Crawford. And if you need us, our number is 479-670-0073. Thank you.
Good afternoon, I'm Cindy with Encompass Health. I am here to talk about inpatient rehab, very similar to what Ashley was talking about. We have PT, OT, and speech. We are known across the nation. We have 170 plus hospitals. We're known for our technology. We have innovative technology, state-of-the-art gymnasium. We work really hard. Our therapists are very specialized on the equipment. And our job is to get you back home, back to those activities. So cleaning house, maybe taking a shower by yourself, whatever that looks like for you, scrubbing the floor. We want to keep you in your home as safely as possible. So give us a call, 479-551-4770. Thank you.
Hello everybody, my name is Margie Parton. I'm a local insurance advisor. I specialize in Medicare, but I also do all insurances from home and auto to health and life, dental, vision, all the things. I did hand out some bags for you guys that has a consent to contact in it. I'm not legally allowed to call you 9 million times, so those people that keep calling you aren't licensed agents, just so you know. But if you need me to help you out at all and you want me to contact you, if you'll fill this out, I'll probably call you once or twice, but I'm not going to sit there and call you 50 times a day. But if you need to contact me, my number is 479-388-4155. Thank you.
Hello, my name is Matt Benedict. I'm with Mallard Medical Supply. We're a DME company. That just stands for Durable Medical Equipment. So when your doctor's ordering you a wheelchair or a walker or anything like that, I'm one of those companies that can provide it for you. So if you have any questions about how to get something or you know if you can, I can fill you in on all that. So.
Well, good afternoon. So I'm with Mercy Crest. We're in Barling, Arkansas. We're assisted living, and we provide all of the needs that you're going to need when you're there. We enrich. Our main goal is to enrich the lives. So I've got a few things wrote down real quick. I do activities, and this is Lisa, our marketing director. And we want to do like the physical things, emotional, purposeful, spiritual, and intellectual and social. So that means exercise. It can be physical. We also want to do it, you know, your emotional ones, maybe a love movie. We have a big movie screen, romance movies, that would be emotional. Purposeful. So what we're doing right now is collecting for the street ministry, and we have a pastor coming in. We're making up care bags. We can take them out to the homeless, so that would be our purposeful. And our spiritual, we have a chapel there, and we also have non-denomination that comes in as well. We have a lot of music there. Intellectual, we play bingo 3 times a week. 3 times a week, bingo. Okay, and social, we have parties. We're having a big party Friday, our Valentine party. And we're going to have lots of prizes, fun. It'll be exciting. We go to Walmart twice a month. We do pedicures and manicures. It's not extra. It's an activity. We do a lot of fun things. If you want to get a hold of us, Lisa will answer your call probably, more than likely. Our number is 479 478-3000. I don't call myself at work, so I have to. Thank you.
It's my first time, so bear with me. I'm Joyce. I'm from the West Central Center on Aging out of Fort Smith. We are a part of UAMS. our job is to go out into our 14 county region and educate older adults on things that we forget about as we get older, health issues. We also go into assisted living, nursing homes, independent livings, into the senior centers, and we do exercise programs that are good for our mind and our body to keep those joints loosened up, because we know if we don't use it, we lose it, right?
Amen, yep.
So, I have some brochures. I can never remember the number, so I can't tell you that.
If you want to know the number, I got it.
She's got it. But if you ever need anything, want to join in one of our exercise programs or need some education, just give us a holler, okay?
If y'all want to do any of Joyce's exercises, I've done them before, let me know, we'll get it together, we'll get a time with Joyce and get it.
Lots of fun.
It is lots of fun.
All right, I think it's door prize time. Are y'all ready? Okay, so if anybody wants to give out their own door prize, if you want to grab it, the members that brought something, if you want to give it, go ahead and get your gift. And Brittany,